But we have selected this day for our event, and thank you so much for your availability. Trying to juggle between holidays of all stakeholders and commemorate the International Day for People of African Descent, which is on the 31st of August, and this year it was on Saturday. So with all organizing and co-organizing stakeholders and friends and colleagues, we decided to use the day of today, 27th of August, to deliver to the Commission an outcome of collaborative work that we have been doing together with EPHA and slowly with other stakeholders from the Netherlands and a lot of civil society organizations and a lot of academics on designing the way forward for addressing the right to health in the EU Anti-Racism Action Plan that is going to be designed after 2025. Thank you so much for the opening that you have given to all civil society organizations, to the UN agencies, to EPHA, to experts, to victims. You have allowed us to have space in which the voices of victims can also be taken on board. And during this event today, we will have a couple of presentations from OHCHR, from EPHA, the body of recommendations as well. We hope to count very much also with your response and craft the way forward. So without further, I think everybody's already in the room. Without further introductions, I will give the floor to the acting representative of OHCHR at our regional office here in Brussels, Elena Kountouri Tapiero, to open our event and give address to the public here and online. We have a lot of participants online, and then we continue with Milka Sokolović. Go ahead.
Thank you very much, Mila. Thank you very much, colleagues. Good morning to everyone. Let me extend a warm welcome and thank all speakers and participants, whether you are in person or online, for joining us today. In particular, let me acknowledge the presence from the Anti-Racism Coordination Team, Ms. Vanessa Kabuta and Ms. Tanja Florath, and the EPHA Director, Ms. Milka Sokolović. Distinguished academics, leading researchers in the field of health and racism, the DisQo network, civil society organizations, colleagues from UN agencies, dear health practitioners. As Mila said, we have chosen 27th August as the day of our event to commemorate the 31st of August, which is the International Day for People of African Descent. This is a day to promote greater recognition for and celebrate the diverse heritage and contributions of people of African descent to the development of our societies. Let me also acknowledge that on Friday, 23rd August, last Friday, the Committee on the Elimination of Racial Discrimination at its 113th session adopted General Recommendation 37 on racial discrimination and the enjoyment of the right to health, jointly elaborated by WHO and the committee. We're very pleased about that. Fighting racism and racial discrimination is a priority for the Office of the High Commissioner for Human Rights. One of the 6 pillars of the Human Rights Program is non-discrimination and equality. Anti-racism work is embedded in the remaining 5 pillars, which are mutually reinforcing. The office has deployed anti-racism discrimination advisors to the 5 regions of the world, including in Europe, Brussels, through the support of Mila. We work closely with policymakers and civil society in defining, supporting the implementation, measuring the impact of anti-racism policy, programs, and strategies at the national and regional levels. Today, we're very pleased and proud to present and deliver formally to the European Commission a document containing policy recommendations for the forthcoming post-2025 EU Anti-Racism Action Plan. This has been elaborated through a broad consultative process and engagement with civil society, academia, health practitioners, victims of human rights violations, stakeholders representing public institutions, and most importantly, people of African descent. This would not have been possible without the excellent collaboration extended to us by the Commission, in particular the Anti-Racism Coordinator, which also allowed us to form important partnerships such as the one with EPHA. The European Public Health Alliance is a leading EU public health advocate with over 30 years of history in Europe. We started working together by zooming on specific human rights challenges faced by racialized communities, including Roma, and really dissecting social rights. We focused on the unaddressed, traditionally overlooked, or highly difficult to work on components of the right to health. The objective was to bridge the gap between abundant academic evidence on the violations of the right to health, racialized communities, and also lived experiences on the one hand, and public policy on the other hand. I want to pay tribute to the very high level of collective expertise of all professionals and stakeholders, supporters of the anti-racism cause who have participated since last year in our collective endeavor. We're grateful to both the European Commission and EPHA for having opened the space and allowing us to contribute to the implementation of the current EU Anti-Racism Action Plan, and to start contributing to the post-2025 EU Anti-Racism Action Plan. On 26-27 June, the European Public Health Alliance and the Office of the United Nations High Commissioner for Human Rights held a two-day conference focusing on the right to health for people of African descent. The conference was co-organized with Article 1, Netherlands, and the Hofnar Present BV. The event featured distinguished speakers from the European Commission and the Dutch Minister of Interior and Kingdom Relations. It included panel discussion, case studies, and interactive sessions. Key topics included the impact of racism on health, challenges in assessing healthcare, and methods for high standard equality data collection. The event aimed to develop actionable recommendations to feed into the next cycle of the EU Anti-Racism Action Plan, promoting health equity and combating racism across Europe. The very rich body of recommendations for the post-25 EU Anti-Racism Action Plan focuses on, first, recognizing racism and discrimination against people of African descent and communities as fundamental determinants of health. Two, strengthening the meaningful involvement of affected communities. Three, using respectful and inclusive language to enhance the quality of dialogue and discourse. Four, addressing major gaps and challenges regarding the collection, availability, and comparability of equality data across EU member states. Five, breaking down silos in policy mainstreaming efforts. And six, addressing racism and discrimination in healthcare and science. Allow me to address specifically the topic of a human rights-based approach to policy and the fact that all the recommendations point to the need to develop the EU Anti-Racism Action Plan with a human rights-based approach lens. A human rights-based approach to policy means that policy and program development pay particular attention to people who may be in a vulnerable or disadvantaged situation based on grounds of sex, gender, race, color, descent, national or ethnic origin, disability, or other. This includes ensuring that people are not subject to discriminatory treatment and that policies and programs should account for pre-existing sources of discrimination and inequity. The human rights-based approach is derived from international and domestic human rights obligations and is used to promote and protect human rights in policy and program development. At its core is the recognition that inequality and marginalization deny people their human rights and often keep them in poverty. A human rights-based approach seeks to analyze inequalities and redress discriminatory practices. It empowers the most marginalized communities by supporting their participation and inclusion in program or policy development and strengthens the capacity of government, policy, and decision makers to respect, protect, and fulfill their legal human rights obligations. Human rights-based approach ensures that program or policy development, implementation, management, budgeting, and ongoing monitoring consider human rights principles and goals, including equality and non-discrimination, participation of impacted groups, and oversight and accountability. Let me conclude by underlining that this is only one of a series of further events and consultations we will have for shaping the post-2025 EU anti-racism action. The focus on health and cross-cutting issues such as participation and data is just the beginning of this process. Until the end of this year and next year, we will continue to carry out consultative processes on social rights, participation, and other relevant topics for the post-2025 EU anti-racism agenda. We also trust that we can expand our solid network and nurture the European and selected national agendas on eradicating racism. A big thank you again to the European Commission for their commitment with the implementation of cross-cutting principles, such as participation and accountability, and for supporting us to take forward the post-2025 EU anti-racism action plan. Thank you.
Thank you very much. And we're inviting now Milka Sokolović, the director of EPHA, to join us and give us her address.
Thank you very much, Mila. Esteemed colleagues, distinguished representatives of the European Commission, esteemed partners of the United Nations Office of the High Commissioner for Human Rights, esteemed international and national partners, cherished allies from the civil society, I feel really honored being with you today in this room and online. As EPHA, the European Public Health Alliance, in the past months, even years, we have been privileged to work closely together on behalf of our members with the European Commission, with the OHCHR, with our Dutch partners, Article 1 with the Netherlands and the Hofnar BV, and with a wide range of civil society actors. Let me remind you that 2 years ago, EPHA, with support of DG Santé and its health policy platform, launched the DisQo thematic network in cooperation with some 40 organizations. Back then, we did not expect to stand here today representing 80 organizations, and with such an amazing piece of joint work on racism, discrimination, and health to feed into the EU anti-racism action plan. We can only be thankful to the Commission and to all of you for making that possible in an integrated, iterative way. We should also note that we have it black on white. Commission President von der Leyen will task the next Equality Commissioner with developing a new post-2025 anti-racism strategy. This means that all the diligent work in the past months comes at exactly the right time. That together we can continue building a shared commitment to a Europe where the right to health is fully realized for all, including for people of African descent. Through those 6 recommendations already mentioned by Ms. Kountouri, recognition, social participation, a common language, equality data, breaking down silos, and addressing racism and discrimination in healthcare and science, the next strategy has a potential to help achieve that right to health for all. These 6 pillars resonate. The European Public Health Alliance has always advocated for a comprehensive approach to public health, one that considers the social determinants of health, including the profound impact of racism and discrimination. And these are not just abstract concepts. They are lived realities that shape the health outcomes of millions across Europe. Though we note a very different political reality where topics like health equity, justice, tolerance, and inclusion are under increasing pressure, it is really comforting to know that we have such a wide range of organizations, individuals, and partners that we can count on to work together towards a union of equality. The recommendations that are being presented today call for the recognition of racism and discrimination as fundamental determinants of health, urging the European Commission to take a leadership role in addressing these issues from a health equity perspective. They are not just policy suggestions. They are essential steps towards ensuring that all individuals in the EU, regardless of their race or ethnicity, have equal access to quality health care and the opportunity to lead healthy lives. One of the most critical aspects of our recommendations is the emphasis on meaningful involvement of affected communities. We believe that policies that impact health must be designed with the voices of those who experience the brunt of discrimination at their center. This participatory approach is not only a matter of principle, but also a practical necessity to ensure the relevance and effectiveness of our policies. We have done our utmost to reflect this need in how we developed these recommendations by including these communities themselves. Let me assure you that the work does not stop with handing over this report. The EU Anti-Racism Action Plan and the Union of Equality Strategies are pioneering policy frameworks that allow for addressing deep-rooted issues of inequities across groups and across Europe. They allow us to counteract those inequities wherever they may start, not just in hospitals or clinics, but also in our versatile communities, schools, workplaces, and in the social and economic policies that govern our lives. Racism and discrimination permeate these spaces, leading to health disparities that cannot be ignored. EPHA is committed to continuing with such approach, not just in the EU Anti-Racism Action Plan, but in other relevant strategies. Today, we are discussing recommendations focused on people of African descent, and in the coming months, we will continue to speak in the context of the Union of Equality Strategies. There is a number of events and activities planned together with the OHCHR and other partners to make sure we continue doing this important work, so stay tuned. Today, with handing over these recommendations, we are taking another crucial step in realizing the right to health, another step in addressing the pervasive effects of racism and discrimination in health. Let us not mark this moment as an achievement of its own. Let this be a call to act, to start moving forward together and faster, to ensure that these recommendations lead not just to change on paper, but to tangible action and changes across Europe. Let's work towards a future where the right to health is a reality for every individual, regardless of their background. Thank you.
Thank you very much, Milka. And now Tomas de Jong will present us in more detail the body of recommendations. Tomas is a policy manager at EPHA. The floor is yours. Thank you very much.
Perfect. Thank you very much, Mila. So now to me, the task of summarizing the recommendations that we've developed in this consultative process, quite a large task, of course, but I'm going to be focusing on some of the main things, some of the main sort of things that pop out that are of special significance in how we've developed these recommendations. While I'm standing here, I'd like to also take the opportunity to say that I wasn't originally supposed to be the one delivering this presentation. That was supposed to be my colleague, Lisa Becker. She is also the one who did most of the work in actually summarizing these recommendations. As you can imagine, there's a lot of work that goes into going through all of the different types of feedback and then trying to work it into a comprehensive document. She's been very instrumental in that. So I wanted to also take the opportunity here to note that. She unfortunately couldn't do it herself because of sickness. But we're thinking of you, Lisa. So thanks a lot for all the hard work you've done in cooperation with Mila and EPHA from OHCHR on developing this document. So if we can move to the next slide. There you will already be able to see, it's been mentioned a couple of times, the 6 recommendations that we're focusing on today. Before I go into them, I would like to first briefly take you through some of the sort of background behind how we got to these recommendations. So, as was previously mentioned, we held a conference in June this year together with OHCHR, EPHA and OHCHR, with support from Dutch partners, Artikel 1 Midden-Nederland, and the Hofnar present base. So these are more local actors in the Netherlands who work on anti-discrimination and anti-racism. And this event was moderated by Jacqueline Bowman, who works for the Adopted Pact here in Belgium. Now, the event is part of the wider DisQo stakeholder network. This is a network that is managed by the European Public Health Alliance. As has been mentioned, it was raised or it was started on the European Health Policy Platform with support of DG Sante. Now, this year's event took place very much in the context of the EU Anti-Racism Action Plan. It's been mentioned a couple of times already. This pioneering policy framework, which allows us to address racism in the European Union. Its current cycle ending in 2025, but we've already had confirmed that there's going to be a post-2025 strategy. The next European Commissioner for Equality will be tasked with developing this plan. We are, of course, we warmly welcome this new development. We're very thankful as well, as has been said a couple of times already, that the Commission is so open to us providing input into this process. And so that is really, that's the background as to why we decided to develop these recommendations in cooperation with our civil society partners in the DisQo network, but also academia and international organizations like OHCHR. That is why we're standing here today. Now, as for the development of the recommendations themselves, so talking more about the consultation process, we very much took a human rights-based approach to developing these recommendations, and that means meaningful participation of communities, has already been mentioned. In this case, particularly focusing on people of African descent, because every single community, every single individual, of course, deserves their own tailored approach in a way. A lot of lessons are cross-cutting, but we also need to be aware of the fact that we do need to focus on specificities as well. During the event, which constitutes the main input also for this report, so the event in June, a lot of topics were covered. These topics were, to the best of our ability, summarized and put into this report and have directly fed into these recommendations. At the same time, it's also important to note that a lot of the work that went into developing these recommendations had already been done. So we had already done a joint statement with the DisQo stakeholder network, which already went through its own consultative process. So this event that we did this year was on top of that to essentially perfectionalize these recommendations to the best of our ability. Now, upon the completion of the first draft after the event, the report was sent to the DisQo stakeholder network, as well as other stakeholders who had the opportunity to provide input. We received a lot of positive input, which was very encouraging. We've also received a lot of very good points. Of course, this did leave us with a task of incorporating that feedback, which was quite a bit of work, but we managed to do it in quite a short time, which I'm very happy to report. So that has ultimately resulted in the recommendations and the report as we're going to be handing them out and handing them over today. Now, as for the content itself, I'm going to be going very briefly through each of the 6 recommendations, just to give you an idea of what they actually entail, why we've developed them in that way, and what they actually mean. So, starting with the first one, we're just talking about the recognition of racism and discrimination, in this case against people of African descent, as a fundamental determinant of health. This is, of course, more cross-cutting, but one of the most important things we cannot state enough that there needs to be formal recognition of racism and discrimination as fundamental determinants of health, as cross-cutting issues if we want to realize meaningful action. Now, a couple of recommendations that you can be thinking of in this context are, well, first, of course, the formal recognition of racism and discrimination as fundamental determinants of health, but also to include racism and racial discrimination and discrimination in legislative and policy documents, really very concretely including them in EU legislation or in EU strategies, for example. Another topic related to this is that we must prioritize training and research funding in that same context. So there needs to be funding made available to prioritize racism and in healthcare training, for example. And a last important point to make is also, for example, strengthening the Racial Equality Directive in relation to health, because there's still ground to cover there. Moving on then to the second recommendation, this focuses on what we call social participation, so meaningful involvement of affected communities and stakeholders. This has already been mentioned a couple of times today, but again, this cannot be stressed enough. Inclusion of people of African descent or individuals, communities that face racism in any way is crucial for attaining equitable health policies or policies in general even. We sort of focus here on the principle of nothing about us without us. That's the central point here. So people with lived experience, individuals, communities that face discrimination and racism, they should be consulted in policies that address these issues. Now, some of the recommendations that you can be thinking of in this context are, of course, first and foremost, involving civil society in the design and the implementation, the monitoring and the evaluation of the post-2025 EU Anti-Racism Action Plan. Another important point in this context to name is that we require an increase in diversity in the European Commission's advisory bodies themselves. And of course, another important point is empowerment. It's very easy to say that we should include communities or individuals in the policy process, but we also need to ensure that these communities and individuals are empowered to do so. This requires them to be empowered through education or through advocacy efforts, being able to participate in these processes. Again, nothing about us without us, but we need to also match actions to words in that respect. The third recommendation focuses on respectful and inclusive language. This essentially means that we need a common language to be able to speak about racism and discrimination. This is also a large challenge, which I'm sure you'll understand, because we need clear and consistent definitions about what we're talking about. For an effective dialogue on racism and health, we need to some degree, be able to speak the same language. What I mean with that is that there is a different interpretation in a lot of cases about what we're talking about. What does racism actually mean and its related topics? Now, of course, everyone has their own view on this, but it's important for us to try to, at least to the best of our ability, to come close to each other to be able to talk about these things. Now, this is no small task. But recommendations, what you can be thinking about in this context is we need a glossary of key terms. This is very difficult to develop, but a first step needs to be made to bring together the experts, have the conversations, and then hopefully in the EU policy context to be able to start having a sort of glossary with definitions, something that we can base ourselves on when we develop policy. Similarly, in relation, another recommendation related to that is that we harmonize these definitions to the best of our ability. Again, it sounds very simple saying it here like that, but that is something that we need to start doing. Moving on to the fourth recommendation, this one is also one that has been mentioned very, very often in the consultations that we've had. It's equality data. Throughout the past 2 years of doing this work, this point has been repeatedly mentioned, as I said, and that is because high quality disaggregated equality data is essential for addressing racism and advancing health equity. And that is because if there is no data, it is very difficult to get an idea of what the problem actually looks like. And therefore, it's also easier to ignore the problem. And precisely for that reason, it is very important that we start making work of collecting disaggregated equality data also on health. Ways in which we recommend this is done is for one, harmonizing equality data collection across the EU to the best of our ability. This requires guidance from member states on how to collect this data systematically, and also, of course, encouraging them, supporting them in actually collecting data specifically also on racism-related issues. In relation, of course, we then also recommend to promote the development of national strategies for systematic equality data collection. That we also need to facilitate the discussion about ethical data collection in a way that safeguards people of African descent. And that we support and validate community-led data collection as well. Throughout the discussions we've had in June, there was a lot of input from community-based actors who did their own data collection, which has been extremely valuable in making sure that we know what we're talking about. And these things should not be ignored. These are also things that are very important to include in the policy process. Moving on then to the fifth recommendation, we're talking about breaking down silos and in doing so, taking action. Now, what this means, to try to make it a bit more concrete, racism is often said as well, it's a complex, it's a deeply rooted issue, it's very structural, systemic, it's institutional. In simple terms, it is very complicated in a way to address. This is reflected sometimes in ways in which this is addressed. Essentially what I mean here is that a lot of specific topics, if you're talking about health, or if you're talking about education, if you're talking about employment, a lot of these sectors will not speak with each other. They will be focused in their own sector, in their own silo. And this is detrimental to developing a comprehensive approach to racism. We cannot afford to have all of these different sectors act only within their own silo. They must speak together. And a word that's often used to describe this, the way of addressing this is policy mainstreaming. Now, this might still sound a little bit vague, but some of the recommendations that we have included to address this issue is, first off, we'd like to see policy coordination strengthened through the Task Force on Equality. Some of you might be aware of what this is, but essentially a task force that allows communication between different DGs on these issues. We'd like to see this strengthened. We've had quite a pleasant experience already working with them so far, and this is something that we'd really like in that context to see strengthened. At the same time, and this is also something that has been deemed very important through the consultation process, adopting an intersectional focus. So we need to acknowledge that when we're talking about silo building, we also need to take into account the diversity within all of the different groups and individuals that are exposed to structural racism and racial discrimination. This requires us to recognize that racism and racial discrimination intersect with other social categorizations and factors. And very importantly, that we should be looking at issues including, but not limited to, or they're not issues, but characteristics including, but not limited to sex, gender identity, sexuality, socioeconomic status, religion, and other relevant characteristics. And this, because these issues can create overlapping systems of discrimination or disadvantage. This is something that needs to be recognized, that we need to be aware of. We need to also emphasize in that context that intersectionality is pivotal and that it's non-dismissible in the work on racism and racial discrimination as it is. So this is already something that is very core to the work that you do when you're trying to take an anti-racist policy approach. Two other recommendations are that we would like to see a further promotion of transparency, again, social participation in that policy mainstreaming approach. And lastly, that we also advocate for the coordination and standardization of national anti-discrimination laws and of equality data collection. So again, that this is reflected also on the national level. The sixth and last recommendation, this one is the one that also most of the input from the event went into. So this is an additional one from what we've originally been advocating for. And it focuses specifically on addressing racism and discrimination in public health, in healthcare and in science. When we look at racism, as also was said in Milka's speech before, it's something that cuts across society. We at the same time recognize that specific action is also required in the healthcare and the public health sector as well. And that is what we're focusing on in this recommendation. Now, what you can be thinking about in this context is one thing that was often mentioned was, and I quite like this saying myself as well, it was raised by someone during the conference, is to shift from a race-based to a race-conscious medicine. So the idea here being that racism is a social issue, but at the same time, we also need to be aware that there are biomarkers from a clinical perspective. Think about misdiagnosis, think about the fact that sometimes healthcare workers are unable to provide a correct diagnosis for people of color. Think about the fact that there are certain devices, medical devices, which might be less suited to help with diagnosis of people with a different skin color. And these are issues that we need to be aware of. But at the same time, we also need to be aware of the fact that racism at its core is also still very much a social issue. So the mix essentially between being aware of the social aspect, but also of the biomarkers. Talking about the healthcare workforce and the public health sector itself, we need to ensure diverse representation. So that's also one of the recommendations that we focus on. It simply cannot be that people in the public health field or in the healthcare sector, those people who we rely on to counteract racism are also the ones who face racism within those sectors themselves. And this is something that needs to be addressed. Related to that, we need to promote adequate representation and diversity within all of the healthcare professions. And as you can see, that relates very much to what I said before. The fact that those people can be facing racism themselves can make that extremely difficult. So that needs to be addressed as well. Related to the initial point that I made as well, we need to ensure cultural knowledge and skills of the healthcare workforce itself, whether that is through training or through other means. That is something that can be debated about also within the healthcare sector itself. But it is something that we also include in our recommendations because it is important that those skills are also there in the healthcare workforce itself. Related to that, also recommendation is included on improving access to culturally sensitive healthcare services. So being aware essentially of the fact that there may be specific treatments that are not covered through insurance, for example. This is something that we need to be aware of and something that needs to be addressed also in particularly, of course, in national policy as well. Now, these are the 6 recommendations. I can imagine that going through this quickly, naming a lot of these several recommendations can be a bit overwhelming. At the same time, you might recognize a lot of these because you are aware of the issues, you work on them yourselves. But this is what is covered in the report that we will be handing over today. To conclude, we of course urge the Commission again to take these recommendations into account, into specifically the post-2025 EU Anti-Racism Action Plan, that these are ways in which we believe that health equity and combating racism can be done in a very structural way. I want to also once more emphasize that our report does focus on health. But at the same time, I cannot stress this enough, it is imperative to mention that human rights are interconnected. They are indivisible, and therefore a lot of the recommendations, well, all of the recommendations covered in this report can be adopted also in other social rights contexts. And that we also very firmly believe that a lot of the lessons that we've taken in this report are also applicable in different social settings, in different social policies. That this is also something that we must recognize. With that, I will conclude. I would like to thank once again the European Commission being here today to listen to us represent these recommendations. We will now move on to the actual handing over of the recommendations. So this is where the awkward bit starts, because now we're going to have to start arranging here in the front. So I would like to ask Tanja, Vanessa, and Milka and Elena to come join us here in the front. Milka and Elena both have a copy of the report. So Fabienne is in the back ready to take a picture. So Milka and Elena here on both sides. Elena here. And the Commission in the middle. And if you would hold up the report and
We do that and shake and smile.
if you want.
Smile.
Okay, have the photographers got what they need?
All good.
All
Perfect.
good?
Okay. Perfect, thank you very much.
Thank you very
That's
much.
the report. Before we move on, just very quickly, we're gonna leave space for questions at the end of the event. So right now, first I'd like to hand over to Tanja and Vanessa, whoever wants to speak first to give us their reflections on the report to the best of their ability. And after that, we'll move on to an interactive session. So after that, there will actually be space for questions. So hold them for now if you can, and then we'll address them in that session. So with that, I'm happy to hand over to Vanessa. You will start, I believe. Okay. So please.
Thank you.
Good morning. Well, first, I would like to thank the United Nations Human Rights Office and the European Public Health Alliance for your invitation. As usual, I am pleased to be here, and let me remind you that our team, our anti-racism coordination team, always appreciates cooperating with each of you. When I spoke here in this room at the previous conference on racism and health inequities for people of African descent, I was concerned that the partisan power struggles resulting from June's European elections would impact the agenda of the future Commission. So today, I am satisfied that last July, our President von der Leyen, elected for a second term, has committed in front of the European Parliament to task an equality commissioner with developing a new anti-racist strategy for after 2025. And our team, whose mandate is to implement the anti-racism action plan, thanks all of you for your recommendations. And I know it's not only recommendations, not only policy suggestions, but essential steps towards health equity, to quote you. We thank you for your recommendations, your policy suggestions, essential steps to take into account for the development of the EU Anti-Racism Action Plan after 2020. At this stage, we cannot promise anything for the future in terms of policy content. Nevertheless, that does not prevent us and myself from suggesting a few proposals and avenues for reflections on some of the problems you have identified regarding the right to health for people of African descent and other racialized groups. First, I also agree that the European Commission could explicitly recognize racism and racial discrimination as fundamental determinants of health, equity, and well-being of racialized groups, including people of African descent. We all know that personal discrimination by healthcare providers is unlikely to be the sole cause of healthcare inequities. Racial disparities in medical care should be understood within the context of racial inequities in societal institutions. It is worth noting that the Commission has made major steps in its approach to anti-racism by acknowledging structural racism and its historical roots in the action plan adopted 4 years ago. With this adoption, the Commission took the side of taking an intersectional approach and mainstreaming equality into all EU policy areas. However, according to the Committee on the Elimination of Racial Discrimination, health laws and policies fail to measure and take into account intersectionality, and thus they fail to mirror how class, social status, income, migratory status, and other grounds of discrimination operate inseparably with race, color, descent, national or ethnic origin, resulting in lower availability of health, for racialized groups of even exclusion, and thus strengthening racial barriers. So, and you called previously, Tomas, for the upcoming years, we should continue working to break down the silos. The equality coordinators, like Isabel de la Mata, that you have encountered last time in June, representing their respective Directorate General in the Commission Task Force on Equality, have an active role by maintaining a horizontal overview of the equality issues in their service. Hopefully, the new anti-racism strategy will be an opportunity to further strengthen, our collaboration with our colleagues, for instance, in DG Ample and DG Santé, who deal with the EU pillar of social rights and the EU for Health programs, to ensure that supports in areas such as social protection and healthcare contribute to equality. Member states should also maximize the use of all the existing tools at their disposal, in particular, the possibilities offered by the EU funding programs under the MMF, the multi-annual financial framework. In the 2021-2027 programming period, EU funds support member states' efforts to promote, among other, equal access to health and social care for all, in particular for disadvantaged groups. In terms of participatory approach, the action plan includes important steps to provide institutional support for the long-standing work of civil society actors, and for the implementation of the anti-racism action plan, and to take stock of the progress in the fight against racism, the Commission should continue reach out to and engage with more civil society actors working with racialized groups. However, civic participation is only effective in an enabling, safe, and supportive environment. Again, I would like to quote you again while you were talking about empowerment of communities. We, as the Commission, we could consider including in this pool of actors working with racialized groups, healthcare professionals in this dialogue. Effectively addressing disparities in the quality of care requires improved data systems, but as well as new initiatives to appropriately train medical professionals and recruit more providers for disadvantaged minority backgrounds. As we know, EU action in the field of public health needs to respect the competencies of member states for the organization and delivery of healthcare services and medical care. The Commission, in cooperation with other EU institutions and stakeholders, remains committed to actively seek opportunities for dialogue and engagement to achieve lasting change. This year, we, the Commission, we will support the implementation of a study on the implementation of the Anti-Racism Action Plan 2025, with a focus on national efforts by member states to tackle structural racism, including anti-Muslim hatred. The objective of this study is to provide an assessment in what way the EU Anti-Racism Action Plan contributed to the overall combat against racism on the EU, member states, and local levels. And its objective is also to consider the impact the action plan might have had on national debates and policy making. And this might include the description of best practices. The study again will also assess different options for the EU on anti-racism policy beyond 2025. and complement them with guidance and recommendation. And the assessment will be complemented by a stakeholder consultation to be organized early 2025. And for sure, we will include the recommendation that you have just presented to us. Using our own participatory tools, we will conduct the Commission a survey-based stakeholder consultation with the permanent anti-racism civil society forum that I presented last year, for those who have retained but know, the permanent anti-racism civil society forum that we have established in 2021, with which we have created synergies. We would like to open it to a wider audience, so EPHA for sure you will be, and also international organizations, academics and other stakeholders are more than welcome to be part of this stakeholder consultation. The current version of the EU Anti-Racism Action Plan encourages member states to involve civil society organizations in the design, implementation, and evaluation of the national action plans against racism. For us, getting input from our stakeholders is an indispensable part of reviewing the EU Anti-Racism Action Plan. And for this reason, I thank you again for your policy suggestions, even more than that. Your views and practical experience will help deliver higher quality and more credible anti-racism EU initiative and evaluations in the health sector. I thank you for your attention and I give the floor to you, Tanja.
Also, good morning. I would like to reiterate my gratitude for this event as well, and copy my previous speakers with it. I think you did a tremendous job by bringing these kind of expertise into one room, and we talked about it yesterday, and the two-day event here was one of the most striking events that we had the pleasure of attending this year, so thank you very much for that. So at the same time, it's an honor to receive these recommendations. Vanessa already said that we are no longer worried about what will happen after 2025, but we now started eagerly to develop an anti-racism strategy and ambitiously aiming to have a positive impact on all racialized people in Europe. And here, of course, health and the healthcare sector play a very important role and are a very important field that hasn't been addressed as properly as it could have been with the anti-racism action plan so far. So looking back at the today's conference, what stuck with me most was a debate about language standardization and its impact on health and healthcare. Because when I go for my annual checkup, my doctor will sit with me afterwards and show me the charts. And most of my indicators will be within a margin of discretion, some higher, some lower. And sometimes he tells me to worry, sometimes he tells me not to worry. Both judgment calls are not necessarily visible for me on the charts, but he knows. And I know that I can trust his judgment because I know that my physique is somehow reflected in these charts and in these standardized margins of discretion. And this should be true for everyone. And when we heard from Rabin and Jacqueline about misdiagnosis because of African and Asian descent have not been taken into consideration, I'm wondering how this can be. And how can it be that my age, my weight, my height, and my alcohol consume is considered, but my heritage and my ethnic origin and my upbringing are disregarded? So Tomas already quoted it, and I wrote it down because it's my favorite quote from the whole recommendation. Your recommendations entail to move away from race-based medicine to race-conscious medicine, while simultaneously considering biomarkers from a clinical perspective. And that's exactly where we want to go. And we can wholeheartedly embrace this approach. However, it's going to be a long-term goal, And it requires to already start in medical training to create an awareness that currently used biomarkers are not representative, at least in Europe, and that doctors need to think out of the box while making a diagnosis and while treating people. It also requires a recognition of the already existing diversity within Europe, which is no longer standardized white male or standardized white female by now, but it's way more diverse than that. So moreover, creating this awareness requires an comprehensive language. What do we talk about and how do we talk about it? Your recommendation foresees a leading role for the European Commission, pointing out the variety of terms and language that we should use. And while part of me agree with that, another part tells me I have to be a bit cautious here because we have seen in this room that language is fluid and a matter of debate and is changeable and needs to stay changeable and flexible. Language will always be a matter of debate and interpretation. And while it is important to have agreed terms that we can work with, we also need to be flexible and engage in constant discussion about language and terminology, especially in regard to what it means to the people that we're actually talking about. So this reflects back on the conversation that we have to have with the people that are concerned. And finally, I would come back to the relevance of data, and I'm very happy to see the long list of recommendations and fundamentally agree with the observation that we suffer a lack of data in regard to racial inequalities, especially in health and healthcare, which is due, in my view, to a general hesitancy to collect data disaggregated on race or ethnic origin. Surprisingly enough, the same hesitation does not apply to data on migrants or place of birth. Hence, many member states use proxies for their data collection, which in the end leaves me with a group of an American overweight 50-year-old and women from Guinea and Thai men from the mountains. And they're all in one group of migrants, but that's not really true. And they don't really have the same health determinant and biological standards. So on the side of the Commission, we are actively engaging with member states to change their national approaches and encourage them to use the human rights-based approach. And Mila, I will invite you to present it again because I've never seen it so clearly dedicated in such a short time. We also already developed the guidelines on the collection of equality data based on racial and ethnic origin that I mentioned the last time already. Furthermore, I'm happy to say that in February 2023, the European Statistical System Committee acknowledged the increasing relevance of equality statistics and expressed support for stepping up the efforts at EU level to improve equality statistics. So in line with the ESSC, Eurostat took the initiative to set up an equality and non-discrimination statistic task force to work with member states, main users and other data producers for more comprehensive and comparable statistics on equality and non-discrimination. This task force is expected to develop guidelines and recommendations for an improved comparability of equality and non-discrimination statistics across member states, to propose methodologies and best practices for extending coverage to different groups at risk of discrimination, to identify complementarities and support the coordination with other data producers. And we are involved in this task force as well in regard to the collection of data based on ethnic origin. The task force aims to complete its work by the end of 2026, and the task force, as it consists of member states, has a different, well, it's still not binding, but the input is a little bit more forceful on member states than just a voluntary guideline. So, you said before, we're not at the end of the road. Vanessa already announced that we're going to have consultations on the strategy beyond 2025. And I'm looking forward to the announced further consultation that this office is going to have. I think it's very relevant. It's for us very, very helpful to have like an 8-page document that basically gives us a guideline and is ready to be copy and pasted, not only for the sector of health, but indeed, as you said, for other sectors as well. So that's really helpful. And I would like to express my sincere gratitude to all people who contributed to this, but generally to all people who work in this area and who are determined to bring this topic to the agenda again and again and again. And also your efforts at hiring, they are not in vain. Thank you very much.
Before we continue with the question and answer or discussion session, I will just take 2 minutes of your time to share with you that without knowing the dates by heart yet, because it's a lot that we're doing, the series of events that we're preparing in service for the EU Anti-Racism Action Plan include now in September, I think 25th of September is the first event in collaboration with you, EPHA, Equinet, and us. One event focusing further on health and data, okay? And also bridging the gaps and exchanging on the best practices that exist from the EU Anti-Racism Action Plan and the Roma Framework Strategy. There is a lot of interconnection that there can be made. Then we have a next event on participation with a focus also on another social right. Most probably it's going to be the right to housing. It's going to be at least 4 hours event. Again, the same format here and online. During which we are going to make the same effort of systematizing the voices of civil society, academics, other experts, and bring it to your service. After this 21st and 22nd of November, date is already confirmed. We're giving from OHCHR with collaboration also of EPHA, big training for our stakeholders who participated in the last event on data and OHCHR methodology on data. And we are sharing before the event, because not many of you probably are going to accompany us in the Netherlands. OHCHR methodology is going to be formally adopted and endorsed by at least 6 municipalities in the Netherlands, including Amsterdam, Utrecht, Rotterdam, Den Haag, Amersfoort. And it's going to be supported also by the Human Rights Cities Network. So this is how slowly, and thanks again, I cannot stop insisting on this, to the doors that you have opened for this type of collaboration. We hope this to bring it back again to the Commission and to keep on feeding to the events that you are making. So the idea is to collaborate as closely as possible with all stakeholders and build on the topics, the ones that you cannot address. We step and we address them, like on health, you have big input, on housing, you will have another one. And that's how we continue. Thank you for the time. I will stop here, and now we are opening for a question and answer discussion session. I know that we have, I saw around 17 comments at least online, right? Sneak peek, and from the public, addressed to all our guests and in-house residents. Any did not go ahead.
Yes. So I would like to know if there is any space for youth, especially students, who is an educator and teacher. So young people are surprised all the time we are speaking, we're talking to them about issues in health, like sickle cell disease. So we cannot tell them to stop loving each other. So, you know, when they are young, they need to love, to know what it is to be in a relation. So is there any space that we can find a kind of curriculum in every school to tell them what is about the health? The second question is about the Mpox. So in June, we've been here. I didn't know, I don't know, maybe you, but myself, I was just surprised to say, okay, in June, we've been here. We've been speaking about many things regards to health. So 2 months later, so very bad surprise, monkeypox. The question is, what is in the agenda for coming days? Will it be the same with COVID? Will we be locked last time? Or what are we expecting to face for next days? Those are my questions. Thank you.
Thank you. Let's see if there are more questions from the floor before we answer first set from here and then we move online. Yes, please. If you can present yourself just.
Isabelle Ver, I'm working for the Belgian Ministry of Justice. Yes, I had a question for the Commission that it was not really clear for me. You speak about a new strategy against racism, but you speak also about a plan. There will be one strategy and one. How will it be? How will it be articulated?
The current action plan goes, the current document is the EU Anti-Racism Action Plan 2020 to 2025. And if you look at the political guidelines that the president already issued, the political guidelines 2024 to 2029, it announces that there will be an EU anti-racism strategy.
But and so no action plan anymore, more a strategy.
Just to continue in this reflection, did you have connection with the minister in Belgium? Because this is for the Commission, and we know that it's a good fight from the Commission. We know that there is a lot of different kind of political who included diversity in the government, etc. But is this a path between our minister or government, Belgium government, and also what happened and the reflection in the Commission? Because sometimes we saw there is very different way of thinking when you work in the Commission and when we see the political action in our country. So just having a reflection, because we have someone from the minister. So it's interesting that having this kind of reflection also, because we know that there is a lot of political decision in Belgium who discriminate a lot of people in Belgium. And so I have this reflection also. Did you have a meeting or something like this? I don't know.
The relationship with member states is my colleague, so I will leave Tanja responding to you properly. But regarding the alignment, I think that we have a good cooperation. For instance, as we are working with colleagues of DG Justice, the Ministry of Justice of Belgium, but also with other member states, and those working with us are aligned with what the Commission is proposing on anti-racism work and also other fight of fundamental rights. Otherwise, it would have been. Of course, there is some. There are some member states, according to the context, social context, and other social context, but also other traditions and customs who do not agree. But those working with us, those attachés, are aligned to us. But I will.
That's more of a general question, so I give more of a general answer to that. There are certain legal standards that are obligatory for the member states, which includes the Racial Equality Directive and the Framework Decision against Racism and Xenophobia, and then their political commitments. And one of the issues that the Commission decided is a very relevant issue, and it's spread all over Europe, is racism. So that's where the Anti-Racism Action Plan comes into play, and it will now be made into a strategy. We're in the process on working on that, which means that there is a political will on the side of the Commission to work with member states in order to address this particular issue. There's also a council conclusion by member states to fight racism and anti-Semitism, which explicitly refers to the instruments, the political instruments that are already there, with a self-commitment of developing national action plans against racism. It's not legally binding, but it's a self-commitment. And when you look at the way member states interdependence, then it's a step forward. So I can only second what Vanessa said in regard to our Belgian colleagues. We work very well with our Belgian colleagues, but I can also tell you from other member states that we're working with that you don't have an administration where everybody thinks the same. So it's always a question of who you work with and what is possible in the particular political situation that you have at the moment. But the Commission's decision to prolong the fight against racism is not connected to the political developments in Belgium. That's also something that I can tell you.
Yeah.
I could make a contribution towards their questions. My name is Walia. I'm a psychologist and also a member of this civil society working on discrimination. I remember years back working as a psychologist at the Tropical Institute, we spent a lot of time with the Minister of Health. So there's been, right from the ground, this drive towards cultural sensitive, cultural skills in healthcare. It's also been driven by the need within the communities and different communities. So I think by the time I'm very happy to see it reach policy level. But for Belgium, I'm very sure that it depends on the Minister of Health. But Margaret, then the Minister of Health, she was very, very active and very involved in this policy planning for cultural skills in the healthcare. Yeah.
Thank you. Milka and Elena, if you can address the question on youth and Pops, I'm not sure, and then we have to move online because besides we are also a little bit above time, right?
Okay, I'll do it quickly. I wanted to take on the one on MPOC. So I'm not an expert, right? But I don't see any representatives of DG Santé, for instance. I'm thinking both DG Santé and national governments will take measures based on the available evidence and on the available data. And I think we need to follow what the WHO recommends, and they have issued communication, both the global and the WHO Euro communication on the new strain and the recommendations. My personal opinion is that we won't be seeing a closure like in COVID, because the way of transmission of the virus is different. But I think the safest for us always to follow the recommendations of the WHO and implement them on national and local level.
Yeah, thank you very much. So just to address the question on youth and children more generally, the youth, of course, is one of these cross-cutting issues that we take into consideration. I mean, at the office level, we have an internal advisory board that is composed of youth, and we aim to ensure their effective participation in different programs and policies that we discuss. I have to say it's not without its challenges, because these youth advisors, I mean, they also have their own life. They need to think of their future career. Most of them are giving up their time during their studies. So it has proven a little bit challenging for us to be able to effectively consult with them. And this issue of, what is effective consultation and effective participation, I think, it really needs unpacking. I mean, it's not that you send an email and that's it. It's not that you do a meeting and that's it. It's not that you get feedback and that's the end of the process. So just to say that this is very much an issue that is a priority for us. And then just to flag something else that we do on 24th of October, we celebrate UN Day, which is when the UN Charter was adopted in 1945. And as part of those celebrations, we also have a program which is called Back to School. So we go to various schools, not only our organization, but all UN agencies. We go to schools and we speak with children and youth on what, of course, what the UN is about, I mean, what human rights is about, but especially trying to figure out the issues that are important to them and how we can take them back into our work and into our program and policy.
Universities as well?
We haven't done universities, but it's something that we can consider.
Thank you very much. Thank you. And Bhavani, if you can share with us summary of some of the questions or comments that we have received online.
Yes, first question is, what would be the difference for the commission between having an action plan and having a strategy? And the question is also, how exactly is this going to change the approach of the commission and also our expectations toward the MS? And the question is from Rosalina Lacheva.
Morning, Rosalina. We don't know yet. As soon as we know, we will let you know.
Another question is from Vijay Naraidu. Are older people of African descent more discriminated?
Thanks that question.
Who takes that question? Well, we don't have a lot of time. We can split between our answers. If we just guide ourselves, for example, by considering the lack of reliable statistical data, whatever answer we give right now here to this question is going to be incorrect. And especially even if we go at the country level and if we try to connect different data sources, let's say cases brought to justice versus cases presented to National Human Rights Institution, which is a different data source. Justice data with National Human Rights Institutions data do not intersect, with health data do not intersect. I'm pointing this just to emphasize again the necessity at national level to have good statistical systems and data collection systems. So considering that we don't have reliable data, what are our proxy sources? One proxy source for us are the international recommendations emitted by treaty bodies. If you run a search through our databases, the Universal Human Rights Index, for example, by country, we cannot speak again about all the European Union, but you start making the searches by countries and you disaggregate by people of African descent and Roma, you will see countries in which we have much more recommendations on Roma and countries in which we have much more recommendations on people of African descent. And you can calculate this percentage-wise just to see what is the weight of people of African descent or Roma people discrimination suffered in each particular country. Altogether, if you take the whole number of recommendations, you will see slightly higher number of recommendations on people of African descent than on Roma. But again, overall, and mean numbers are not exactly the correct data source because they hide a lot of diversities between, for example, countries such as Hungary, Romania, Bulgaria on one side, where the data are skewed by the Roma population data. So depends, of course, in which country you are operating. And then see data based on complaints, data based on judicialized cases are going to give you the exact state of art. And then academic articles, again, like academic research shows you that there is more discrimination in this sector, but then of course, this can be the outcome of having more research done on people of African descent than on other populations. Anybody else wants to add on this from the colleagues?
This, you basically said it all. It's like, it's not a question that gets a clear yes or no, because it's also a question of like, who do I compare this group with? Like, what's the other group? Is this older people? Is this white people? Is this everybody who's not of African descent? What do we mean by older people? And then we have exactly this lack of data that prevents us from answering the question as soon as it's specified enough.
Yeah, maybe briefly to add on, sorry. Just to add on top of that, I mean, one of the things that is included in the recommendations, of course, is what we mentioned on intersectionality. The point also being that, you know, anti-Black racism and ageism can intersect, or anti-Black racism and homophobia can intersect. And these things are, it's difficult to give a clear answer on yes or no, but at the same time, I think the most important thing in that context is that we have those conversations at the very least, that we at least get a bit of an understanding of what that may look like and how we can address it, while also talking about the points made about equality data. But that's at least something that is also in that way reflected in the recommendations. So.
Yeah. No, I just.
Vanessa, then Rachel. Yeah.
Sorry. No, I mean, of course, I don't have a proper response to these questions, but I think if we want to address all ageism and racism or Afrophobia, I think it is important to say that older Black people face a lot of challenges, especially in the health sector, but which are quite similar to what South Asian older people are facing. For instance, in the context of countries like Belgium, France, United Kingdom, you have had migratory flows since the 70s. You have now older Black people setting down here in Brussels, Paris, whatever. And it's difficult for them because of cultural issues, traditions, customs, to be in this kind of healthcare settings. They face indeed racism, discrimination, and that's why it's important, and someone mentioned it, cultural skills. It's important to have healthcare professionals understanding these. Now, as we are staying in our communities, our grandparents, our parents don't go home, they don't go back like they used to do. They used to retire back to the country of origin. They don't do it anymore. So I think these are, yes, avenues to explore. But I won't say that they are more discriminated. I would tend to compare them to South Asian, to what South Asian older people are experiencing also.
Rachel.
Hello, my name is Rachel Hammonds, and I work with WHO in Geneva on human rights issues, and I contributed in a very small part to a previous conference and also the recent general recommendation on racism in healthcare, which you guys heard last Friday. I just wanted to comment on this. What is the evidence that we're looking for to understand whether one group is more discriminated against or not? I know from my research with the European Health Equity Status Report Initiative that we have a lot of missing evidence across the EU. And at WHO, we also look beyond the EU and we also find missing evidence. But we always say, and this is a very English type of phrase, that the absence of evidence is not evidence of absence. So just because we don't have the evidence, we don't have the data yet, in your recommendations, they say, we need better data. So we need better data, but we shouldn't assume there's no problem. And that's what I hear. We need to find more creative ways of bringing voices to the front so that we can address problems that don't yet appear in our evidence, but we know from different communities and civil society groups that those problems exist. Thank you.
Still some good questions online. I don't know if we have the time to.
Well, we are beyond our beyond 11:20, and we always feel very uncomfortable when we have to stop people from participating. So I will just ask a question: if you would be available to stay probably 6-7 more minutes, just to take a couple of more questions or reflections, even if we cannot answer them very much.
I'll try to read them fast as well. We have a question from Italy. And they ask if there's any mechanism already put in place to make states adopt an intersectional approach to data collection. And because without this, it is difficult to achieve the goals presented today. The person also mentions that in Italy, they still do not have any disaggregated data collection.
Yeah.
Are there more?
Yes, there's also a question from somebody who's part of different mental health organizations in Holland. They say that due to the dominance of right-wing political governments in the Netherlands, what can community and people of African descent organizations do, and how can the Commission help to keep these issues on track? If I could also ask another one. We have a question in French, I can translate it. It's about how youth in Belgium face a lot of racism. This person works with schools, and there's no space for these children to actually express their problems. And what can we recommend to them in the immediate circumstances? How to improve their situation.
Let's wrap up with these questions. Remember that the recording and the full report are going to be made available on our websites, so you will be able to consult it. Who would like to respond to the questions that Bhavani shared with us?
Maybe I can respond to the one regarding mental health issues for people of African descent, how we can help them participating, contributing to our policy. This is what the question.
How the Commission can also help to keep these issues on track, and in the context of right-wing political governments.
But I think it works for all the contexts. I mean, the way we can keep it on track is still via the collaboration that we have with European partners, with all the stakeholders working on healthcare sectors, also with our colleague of DG Santé. I know there is a program, I don't remember, but there is a program of mental health that have been promoted, I think, this year or maybe in 2023. On our side, again, on our side, anti-racism coordination team, we should really be willing to cooperate with them, or at least to be part of all the discussion in order to have equality, racial equality, in the policy work that is done on mental health issues, so that this particular angle, this particular aspect is highlighted in the work that they are doing. This is how I will respond regarding this question. Maybe on the other questions for children facing racism at school in Belgium, there are some mechanisms in Belgium fighting racism also at school. I am thinking of UNIA, which is an equality body at Belgium level. They are doing a tremendous work on anti-racism. At school, also local counselors, they can have a role, an active role regarding this, but I will maybe benefit of the presence of the Belgian attaché maybe here.
But is in Belgium you can, so children at school you can go by UNIA in the French part of the country, but if you are in the Flemish part, you have to go to the other equality body, which is the VMRI. But you have also the indirect commissaris, and the Délégué Général aux droits de l'enfant, which are responsible for the rights of the child. So you can answer to those questions.
I think the person was francophone. It was, so yes, the Délégué Général aux droits de l'enfant is really something where they can address the issue.
Okay. This is amazing always when we are beyond time that there is still interest to continue. We have 1, 2, 3 more hands and with this we stop. If you allow me with the colleague over there, Elena, Tanja, and with Tanja we close.
I'm Aida Yansi. I'm part of ELC. It's Euro Central Asian Lesbian Community. But actually, I'm speaking now as an anti-racist activist that I've been in Belgium for a very long time. I have wondered, the question that was asked was really because about children, the first step when it comes to discrimination and racism at school is usually not to go straight to UNIA, because UNIA is going to be to signal that there has been some racism, some violence. First and foremost, we need to recognize that this racism may be granted as discrimination, and then we can go to UNIA. I think that the first level for students at schools are mostly that they need to have a space to be able at least just to have the racism recognized.
Yeah.
And as the question was also surrounding other questions about mental health, I think this is a very urgent question that we do not really have an answer to, or maybe you do have an answer to. But at local level and at the Belgian level, there isn't really a space to discuss racism and the impact of racism. The only step that really exists is we can complain about it in a very formal setting that is not really accessible to a 15-year-old in a school somewhere, I think. And that is maybe something to think about for the future.
Yeah.
In creating support systems, in which of course may not be directly linked to DG Just, or but we can be creative.
Yes.
No, I just wanted to add for the issue of racism in schools that again, 20 November is the International Day for Children, is the date of the adoption of the Convention on the Rights of the Child. And we are organizing a few events with UNICEF Belgium and also with Belgium on awareness raising, sensitization, and specific education, the educational aspect. And I think racism is a topic that we really need to address more. Thank you.
Famous last words. So I would just like very quickly, it's a question of right-wing politics, because it comes up again and again and again in the last couple of months. And my apologies if this is a little bit of an institutional response, but human rights are not a left-wing issue. Human rights are a legal framework, no matter what political color your party has. So it will be complicated for political measures, but you still have a legal framework in place in every single member state in Europe. And this is also our mandate. So we have European fundamental rights and fundamental freedoms, and equality and the Union of Equality is built on that. It's not a left-wing idea. It's part of the institutional frameworks that we work with. So there are some years where it's harder to work with it and some years where it's easier, but the framework does not disappear. And I like to emphasize this in regard to this particular question, although I know that it's harder and more difficult on the ground and to get funding for community organizations and so on. But please have in mind that you always have a recourse to go to, and that is the existing law, which is independent of the political direction. And then finally, the intersectional data collection. So maybe that's something where we also have to clarify equality data. Equality data is not only on racial discrimination. Equality data is a very, very large field. And equality data gives space or gives discussion for all kinds of intersectionality issues. And that starts with age and gender. So if you have data collected on a population that you can differentiate according to age and gender, you already have an intersectional approach to a data collection. That doesn't do us anything good, because we can't get the data that we need on racial inequality. but that's one of the approaches that is already there. And at least to my knowledge, there's no European member state that does not have some possibility of disaggregating data to some level on equality indicators. So what we're trying to do is encouraging them to extend their portfolio and to include racial inequality in the data that they collect, so that there we have a clearer picture. It's not an approach to convince them to have intersectionality at all in. So, and then since it's the last word, many thanks for your patience, and I'm actually looking forward to continue this conversations in all the different spheres. And thank you, Mila.
Thank you very much. Thank you, all of you. Now we can bring the conversation outside to the coffee break and the croissants if some are remaining, and then we will systematize the questions received in Zoom and we will circulate with you if you have to address something. Thank you so very much.